Good morning, everyone. Welcome to Medication Basics. My name is Allison Burns. There is about over 40 of you on this call. So to make it less distracting, we are going to shut off our videos and we will start the webinar. Okay. So again, thank you for joining us. This is the first of a 12-part webinar series. In this foundational webinar, you'll learn about doses, directions, and the effects of medications in the congregate care setting. Again, my name is Allison Burns. I'm very happy to present this first webinar today. I am a pharmacist, and I'm also president and CEO of EMO Health. And we are a nonprofit that provides medication support services in the congregate care setting. I'd like to give special thanks to BSAS. We put this webinar series together for our BSAS licensees so we could really demystify some of the questions around medications and in the congregate care setting. So what are our learning objectives? This is what we would like you to be able to do on your own by the end of the day. We want you to be able to define what a medication is and how this applies to prescriptions, over-the-counters, vitamins, and supplements. Describe how medications work, including desired and undesired effects. Identify the characteristics of a medication, including the strength, dose, dosage form, frequency, and route. And finally, explain your role in monitoring resident medications and supporting safe medication use. So what is a medication? Medications truly are powerful substances. They play a very important role in our physical, emotional, and mental health. Nearly 82% of American adults take at least one medication and 29 take 5 or more. So it isn't uncommon when people may come to a congregate care setting with many medications. This is not out of the norm. However, understanding what a medication is, how medicines work, and what our role is as congregate care staff is important to support recovery. We really have a professional responsibility to make sure that our residents have a safe, healthy, and supportive environment to take their medications in. So let's start off with the very basics. How do we define a medication? A medication, sometimes called a medicine, is a substance that's taken into or placed onto the body that does one or more of the following. So it can, 1, be used to cure, diagnose, prevent, treat, or relieve symptoms of an illness, disease, or health condition. 2, can be intended to enhance mental or physical well-being. 3, has a measurable effect on human physiology, meaning a measurable effect in the body. So let's look at some examples. Antidepressants, these are given to treat depression and anxiety. Antibiotics are given to cure an infection. Over-the-counter pain relievers like ibuprofen are used to relieve symptoms of headache, cramps, and muscle aches. Prenatal vitamins are given to prevent certain birth defects. IV dye or contrast, which is given before an MRI or CAT scan, helps doctors diagnose cancer, torn ligaments, and many other health conditions by making them more visible on the medical imaging. Fish oil supplements. These are also considered medicines because they can be used to enhance our physical and mental well-being. These in particular may help to reduce inflammation and support brain function. Acetaminophen, this is a medication that is given for its wide range of measurable effects in our body. It can be used to reduce fever as well as reduce mild to moderate pains, anything from headaches, menstrual cramps, toothaches, osteoarthritis, and body aches from a cold or flu. As a result, acetaminophen, which is the main ingredient in Tylenol, is in over 600 different prescription and over-the-counter medicines in the United States. So let's dive right into testing your knowledge. Which of the following is an example of a medication? And I know we have a poll going at the bottom. So A, an antacid purchased over the counter to help with heartburn. B, prescription birth control. C, vitamin C supplement that might be used to boost your immune function. Or D, all of the above. All right, we're going to give you a couple more seconds. Yes, everyone who answered D, that is correct. All of the above. In general, there are 2 categories of medications, prescription and non-prescription. You can think of that as everything else. So a prescription, sometimes it is expressed as the acronym RX, is something that is prescribed or ordered by a medical provider. So a doctor, a nurse practitioner, a physician assistant. A prescription is used by a specific person for a very specific reason. It is dispensed by a pharmacy, and medications that are prescriptions typically have stronger effects. They're going to come in higher doses and they have a higher potential for misuse. They're used to treat our major diseases and illnesses. On the other side, we have non-prescription. These are all of our over-the-counter drugs, vitamins, dietary supplements. These do not require a prescription, although they still may be prescribed, which we will explain later. These are used by the general public for a variety of different reasons. They're purchased right off the store shelf. Generally, they are safer. They do come in lower doses, and they typically treat self-diagnosable conditions. So something that is familiar or common, like a headache. Some medicines fall into both categories. So what do I mean by that? How can something be a non-prescription and a prescription? Well, this occurs for two reasons. Either a healthcare provider will prescribe a non-prescription medication. So, for example, someone might prescribe a multivitamin to support nutrition. Individuals with alcohol use disorder sometimes are low in vitamin B. So that is an example that you might see, and a doctor will prescribe that in the congregate care setting. Or prescription medication was switched to an over-the-counter by the FDA. Why would they do this? One perfect example is Plan B, which is an emergency contraceptive. It was moved from behind the counter to in the aisle to reduce the stigma and improve access for women. And in fact, over 700 medications have been switched from RX, so behind the pharmacy counter, to in the aisle, as in over the counter. And what does it take to move something from behind the counter to over the counter? Well, you have to meet these four basic credentials. So low potential for misuse, can be used to self-diagnosable conditions, short duration of use. Typically, all of our OCTs, for the most part, are going to be a 7-day course of treatment. It will be right on the back of the container or the box. And after that, it's going to say, contact your healthcare provider to make sure that you aren't masking any symptoms, make sure nothing else is going on. And these can be used relatively safely and effectively without seeing that healthcare provider. So again, these are for your self-treatable minor ailments, a headache, menstrual cramps, even lice. You can get medication for that over the counter. It's important to understand that even though there are two different categories, medically prescribed does not necessarily mean safe. Prescribed medications can cause serious injury, anything from stomach bleeding to seizures and accidental poisoning. Ibuprofen is a great example of something that can cause stomach bleeds. A medication that you might see in your practice setting is bupropion. That is a medication that can actually lower the seizure threshold. So if someone has an underlying seizure disorder, that might actually precipitate a seizure. The over-the-counter medications, though, this also doesn't mean that they're without risk. Doesn't mean that they're harmless. And a perfect example of this is Tylenol. Tylenol is actually, believe it or not, the most common cause of acute liver failure and the second most prevalent cause of for acute liver failure in the United States, and the second most prevalent cause of liver failure that would later require transplantation, so a transplant. So something as simple as buying a Tylenol over the counter, you really do have to be careful with these. Prescriptions, over the counters, vitamins, and supplements, they do carry the same risks. They can all interact with one another, they can cause side effects, and they can all cause allergic reactions. So for this reason, all prescriptions, OTCs, vitamins, and supplements are considered medicines, and they need to be handled the same in residential care. The reason we're bringing this up is because it can be overwhelming. Someone comes to your residential program, they have a bag of medications, and some of them are vitamins, some of them are purchased over the counter, some of them are in prescription bottles. This can be very overwhelming for staff. What we want you to know is treat these all the same because they do all have the same risks. Furthermore, whether it's a resident or some houses have a house supply. So maybe a house supply of Advil, house supply of Tylenol. Either way, all medicines, house supply or those belonging to a resident, they have to be properly stored, documented, observed, and disposed of according to the BSAS regulations. Our follow-on webinars, we actually are going to get into each one of these. So what is proper storage? What is proper documentation? How do you properly observe someone self-administer their own medication? And what is a process for proper disposal? Each one of these is going to be touched in detail in a further down the line webinar. So if you have questions about those, don't worry, we understand and we will get to those. We want you to know that the regulations do apply both to scheduled and as needed medications. Each treatment plan should have a complete list of all the medications that a resident is taking. And this is important because there are medications that are taken off site. So if we're thinking of things like Vivitrol, methadone, another great example is a long-acting antipsychotic that's injected. It might be administered off site. It's important to have these on the list. It's also important to include all the medications that are stored outside the med room. So per the regulations, must document what medications and how much of those are stored in the resident room. These are going to be your medications that are used for emergencies. And what I mean by emergency is a rescue inhaler or an EpiPen. Those are probably the two most common examples that you're going to see. This is something that the person needs because in the time that it will take for them to get to the med room, to get this medication in them, they could have serious bodily injury. That's how I want you to think about these. Otherwise, we really should, for the safety of the house, for the safety of the residents and the staff, make sure our medications are locked up and documented appropriately. All medications are drugs, but not all drugs are medications. So what do I mean by this? There are questions about, these are powerful substances. How should we really handle these in the congregate care setting? So this is an important concept. All prescription medications are drugs, but not all drugs are medications. What do I mean by this? Well, where medications and drugs differ is in their purpose or their reason for use. So an example is Percocet, OxyContin, fentanyl, and heroin. These are all opioid drugs, but heroin is not a medication because it does not have an approved medical use in the United States. It has not been approved to be used since 1924. Prior to that, it was actually available by prescription. It is a prescription in other countries, but is not a prescription in the United States. So that is important to know. We do have medical uses for fentanyl. We have fentanyl patches. We have fentanyl lollipops. Actually, there are many different forms. These forms are used for very severe pain. And of course, most people know Percocet, OxyContin. Again, all opioids, these are all drugs, but heroin is not a medication. It does not have an approved use. Another important concept that we want you guys to understand is one medicine, it can be prescribed for many reasons. So we just talked about what is the difference between a drug and a medication, the reason for use. One medication, it can be used for many reasons. For example, quetiapine, the brand name is Seroquel. This can be used for the treatment of schizophrenia, bipolar disorder, can be used as an adjunct in depression, and it can even be used to help with sleep in low doses. Now, if you're feeling completely overwhelmed by this, that is okay and that is normal. Staff are not expected to know every detail about a medication. We don't expect you to know what quetiapine is, what its brand name is, or even what the dose is supposed to be for sleep. We don't expect you to know these things off the top of your head. However, we want you to understand what your role is. So medical providers, they are expected to diagnose and prescribe medications. The pharmacists, they're expected to check the doses, directions, and dispense those medications. They also sometimes give vaccines, which is another type of medication. So they do administer. Congregate care staff, they're expected to monitor the medication. So that means they've been prescribed, they've been dispensed, and now we're in the congregate care residential setting. Your role is to monitor the medications, support your residents take medications as directed or prescribed, and prepare them for life after discharge. So what do I mean by that? They are self-administering their own medications because they need to learn these skills so they can use them when they are on their own. If they don't know how to administer their medications, when they're in congregate care, they're not going to be able to administer them properly when they're on their own either. And we know that that can destabilize someone and that can jeopardize recovery. So this can include teaching recovery skills or recovery positive interventions that are related to safe medication and safe medication use. This is our job as congregate care staff. Residential care is often the optimal and safest place for a resident to actually try a new medicine or try a new dose in early recovery because they are in a supported environment. If they were on their own, they might not have the support they need and they might not have the monitoring that they need. So what I mean by this is when someone is, let's say, in ATS, so in detox, they are there to stabilize. CSS, again, they are there to stabilize. Detox is meant to, get through a withdrawal safely. We don't want anyone to have experiencing life-threatening seizures, which could happen from alcohol, benzos, etc. But ATS is really meant to address the withdrawal. It doesn't address the behavioral or necessarily the emotional or mental aspects. CSS, that's where they're stabilizing. TSS, just like it sounds like, it's transitional. Where they're finally able to work on the behavioral aspect is in congregate care. So it really is sometimes the safest place for someone to get on a new medication, to try that different dose, to finally see a doctor and address these underlying issues. It is very important to remember that a program cannot deny admission on the basis of medications. That's actually a violation of the regulations. It's 105 CMR 164. What do I mean by this? You cannot admit somebody to a program. You cannot deny them treatment purely because they are prescribed methadone, purely because they are prescribed Suboxone, purely because they are prescribed a controlled substance or even a substance like gabapentin, which is tracked on the PMP. That is not allowed. And so we want to give you guys the tools so you understand what your role is and what the program's role is moving forward. If you suspect the medication is being misused, notify a supervisor right away. Substance misuse, we have to remember, substance misuse is actually a symptom of substance use disorder. Therefore, staff are responsible for addressing this misuse therapeutically. What does that actually look like? Okay, so it is different for every person, but these are some examples. You could consider using a medication support plan, adherence checks, other recovery positive medication skills. We're teaching them skills so they can live a healthy life in recovery when they leave. And of course, you're teaching them the behavior modification. All of that you're teaching in congregate care. Now, if a resident is at risk of withdrawal or requires more intense medical supervision, you should consider moving them to a higher level of care. Again, every situation is unique, and really what we're trying to do here is we want to prevent someone from being discharged. We want to retain people in treatment. We want to also prevent someone from relapsing in that individual, and we also need to maintain the safety of the program for the other residents. So again, when something's being misused, should be addressed therapeutically, immediately bring that to a supervisor and to the treatment team so they can handle that in the treatment plan. How do medications work? So now we know, all right, what is a medication? We know what our role is. Now, how do these work? So they can work in a variety of ways to improve health. Medications are used to fight infections. So, for example, amoxicillin for a bacterial infection, even an ear infection. We have Truvada that fights HIV. We have Valtrex, which fights cold sores, which are part of the herpes simplex virus. We have Epclusa, which you might see in your own settings because it's used to fight hepatitis C infections. Medications can destroy abnormal cells that cause cancer. So a great example is chemotherapy. This can be used for melanoma and many other types of cancer. Medications can also replace deficient substances such as hormones and vitamins. So if you're thinking of someone with diabetes type 1, they're going to use human insulin because they don't produce enough of that. Levothyroxine in thyroid disorder, that helps replace thyroid hormone. Estrogen for women who are in menopause, their estrogen levels are going down. We have medication or prescription estrogen that they can use to replace those levels. Or someone with anemia, they might need extra vitamin B12, so they could get that as a prescription as well. And finally, medications can also change the way our cells and chemicals in our bodies work. So what do I mean by this? Some examples are atorvastatin, which is part of the statins. These are used to lower cholesterol. How do they actually do that? Well, they work by blocking a substance, which is an enzyme, in your body that actually needs to be made in order to make cholesterol. So it slows the production of cholesterol and lowers it in your body. Sertraline, this is a antidepressant. And how does it work on depression? It works on the neurotransmitter that many of you might know is serotonin. Viagra, this is interesting. This was actually originally developed, believe it or not, for high blood pressure. And it actually works by increasing blood flow, and that is how it is used for erectile dysfunction. So as you can see, medications can work in a variety of ways. Now that we know how they work, we need to know what effects they have. So we're going to go through each one of these. Every medication should have a desired or therapeutic effect. That means the medication is doing what it is intended to do. They can also have adverse effects. These are undesired effects, and these can occur at any time. The examples are a side effect, which is really an intolerance to a medication. So let's say you get an upset stomach, you're nauseous. These may be tolerated if the desired effect occurs and there's no other medication available. We're going to explain what that means. An allergic reaction. Now, this is not a side effect. It's actually an immune response. Your immune system is reacting and it is sensitive to a certain substance or allergen that's been brought into your body. And anaphylaxis is our most severe allergic reaction, and that's life-threatening and can even result in death. Now, paradoxical effect. That means the medication is working in a manner that is opposite to what it's intended to do. And no apparent effect. That is when a medication is not really working as intended. So someone might say they aren't really feeling the medication. We're going to talk about that. And this can lead to a partial treatment response or sometimes no response at all to treatment. It is important to remember that medications work differently for different people. And some people, the medication isn't going to work as well for them. And they're probably going to try another option. And thank goodness we do have many options for them to try. So what is a therapeutic with a desired effect? This means the medication is working. It's effectively treating the resident. How does it do this? It might be improving their symptoms. It might be stabilizing their mood. It's a positive or beneficial response that someone will get from taking their medication as prescribed or as directed. And when I talk about as directed, that means as directed according to the instructions on the back of a vitamin container or on the back of an OTC container or box. So something that's purchased in the aisle. Everything comes with a set of directions, which we will also talk about later when we talk about characteristics of each medication. Some medicines need to be taken for a specific amount of time to work. So even if a resident feels better, it's critical for them to finish the entire medication. This is where we as congregate staff can have a very big impact on adherence and an impact on health. And so what do I mean by this? For example, if someone stops taking an antibiotic too soon, say they have an antibiotic they take twice a day for 7 days, and they feel great on day 3. If that individual and that resident, if they stop taking it at the end of day 3, the infection can actually come back. And when it comes back, the medication might not work as well. That's actually known as drug resistance. So if you see a resident who has not finished something like an antiviral medication for Hep C, or if they have not finished their course of treatment for an antibiotic, talk to them, find out what's going on, because we don't want this infection to come back and the medication not to treat it. All right. So on the other end of things, I don't feel better. This medication isn't working. I'm sure many of you have heard this. It's not working for me. No effect. Now what? All medications work for some, but no medication works for all. That is something to keep in mind. If a resident says a medicine isn't working for them, let their counselor or their case manager know, and then help them contact their healthcare provider. What do I mean by this? Many people are overwhelmed with the healthcare system. They have very poor health literacy, as we say. They don't know how to navigate it. And we have a role as recovery navigators. Just telling them contact your healthcare provider sometimes isn't enough. Take the extra step. Ask them, do you have the healthcare provider's phone number? Do you know the 24-hour line where you can get help if it's like after hours or on a weekend? These are what we should be. These are the questions that a counselor, a case manager, even a recovery specialist, if there are no clinical workers on staff at the time. These are the questions that we need to be asking, and it is on us to teach our residents these skills. They might not even know how to contact a healthcare provider, but that is something that we can teach them. That is an incredible life skill that they should learn in the congregate care setting. So we are actually setting them up for a healthy lifestyle when they leave. Stopping a medication on your own can be pretty dangerous and actually can make someone feel worse in the long run. So if someone thinks it's not working and they just stop it without talking to their healthcare provider, I want you guys to be able to talk to the residents and let them know, hey, you should probably reach out to your provider. You might need just a different dose. Maybe they need to adjust it up and down. Maybe you need a medication altogether. But the last thing that anyone wants is for someone to destabilize and to jeopardize their recovery simply because they didn't think a medication was working. Sometimes the effect of a medication can actually be hard to measure. And why? Some of them take a while to really kick in. So for example, antidepressants can take up to 4 to 6 weeks to actually start working, to have a full effect. And it's hard to really judge, is my mood really improving when it's over that long? If it's just a little bit every day. So it's important for us, again, as congregate care staff, to support our residents. Let them know, hey, if you don't think it's working, we're not there again to diagnose them, but let them know there are some medications that do take a while to kick in. Let's talk to your provider about it. Talk to your provider about it so nothing happens with your recovery. It's important. Support them. All right, adverse effects. What are these? These are your undesired, unwanted, and unexpected effects that can occur at any time, even if the medication's been used before. So what do I mean? A side effect. This is an undesired effect of taking a medication that occurs even when the medication is taken exactly as prescribed. Just because someone gets an upset stomach or is overly drowsy or has diarrhea does not mean that they have not been taking it as prescribed. Okay, I want you guys to understand that. There's also allergic reactions that can occur. Now, this is when your immune system actually overreacts to an allergen. This could be dust, it could be pollen, it could be bees, it could be peanuts, and also certain medications. Probably the most two common are medications that are in the penicillin family, so your penicillins, or your sulfa drugs. Now, I would highly recommend, if you have not done already, if you have a medication counting tray where people dump out their pills, capsules, tablets to count, I would highly recommend that you get a separate tray and label it sulfa, and another tray and label it penicillin, because if someone dumps out, let's say, a Bactrim prescription, there's a lot of dust sometimes that comes with those. And by dust, I mean it is actually a powder, let's call it that, a powder around the tablet. That powder can get on the medication counting tray. If someone in line after that person has a very severe allergy to sulfa and they also dump out their medication on that same tray and they count it and then they take it, they can have an allergic reaction. So make sure that you do have a separate tray, label it sulfa, label it penicillin, and keep those on the side. Make sure you're also cleaning them regularly. Actually, the best way to clean them, the way they do it in the pharmacy, is they use 70% rubbing alcohol, which I know we don't normally keep that in the congregate care setting. So I don't know if you're going to work a way out for someone to do that, take the medication tablets outside to do it, take it home to do it. But those counting trays should really be cleaned with, you just spray them. You spray them with rubbing alcohol and actually you let them air dry, and those will clean that. Also important to remember, someone can become allergic to anything at any time. So even after childhood, just because they didn't have an allergic reaction to this medication when they were 5 doesn't mean they're not going to get it at 15 or 35 or even 55. The reactions can range from just very mild itching or a rash to severe trouble breathing. So anaphylaxis, this is a severe life-threatening reaction. Now, I know that in a medical emergency, it can be tense. So now I'm sure people are thinking, okay, there's all these medications. Now I have to worry, is someone going to have a side effect? Are they going to have anaphylaxis? Don't be overwhelmed by this. You guys are probably the best at handling medical emergencies, and I'll tell you why. Congregate care staff respond to overdoses. Overdoses are extremely tense. They're scary. You guys are experts at that. So just remember, validate your experiences. Remember, don't panic. And I want you to think this. Think fast. All right. Anaphylaxis. Face. If their face is puffy, they have swelling of the face, the lips, the tongue, airway, they're having trouble breathing, swallowing, or sometimes even speaking because the throat is so swollen. Stomach, this could be stomach pain, vomiting or diarrhea, and then total body. This is a blotchy rash, itching, weakness, dizziness. Sometimes people can even pass out or faint. When you see someone having these symptoms, think fast. Severe anaphylaxis is typically treated with an EpiPen, which is epinephrine. For this reason, residents should really carry this on their person. They should carry it with them. And staff should also know where a resident keeps their EpiPen. So if the resident keeps an EpiPen up in their room, but we didn't know that they keep it in their backpack in the closet, that's not going to help us during a medical emergency. So I want you guys to have those conversations with your patients who do have EpiPens. Make sure that they have one and that it's accessible and that you guys also know where it is in case of an emergency. Always call 911 because it is a medical emergency. They should go to the hospital. And remember, do not panic. Side effects. Okay. Side effects are more likely to actually occur when you're starting a medication or changing the dose. Some side effects are going to go away on their own. They're going to go away in time. Others, for example, constipation caused by buprenorphine, which is the main ingredient in Suboxone, sometimes that may last a while and it may even require another medication to relieve. So what do I mean by that? Someone might be constipated and need an over-the-counter stool softener or even a Senna tablet, so like a stimulant to help get things moving along. If a resident is continually missing their doses or even stops taking a medicine, it's important to find out what is going on. Ask them, are they having side effects? Why aren't they taking the medication? If they're not taking it because of a completely intolerable side effect, help them contact their provider. Find out if there's something else they can use or if they can make some type of adjustment. Sometimes it's just as simple as changing the dose or taking an extra precaution. For example, a medication that causes really bad upset stomach may be as simple as take with a meal, take with food, take with a snack, and they won't get the nausea. Sometimes a medication, though, is continued if the benefits outweigh the risks of the side effects, or there just really isn't any other treatments available. So what do I mean by this? Sometimes there really are side effects that we just can't prevent. And so examples of that is chemo and HIV treatment. Chemo, it's awful that people become so ill. It's awful that they lose their hair. But at the end of the day, the risks of those side effects, those don't outweigh the benefits of treating the cancer. So sometimes, again, encourage the resident to reach out to their provider, see if there's another medication, see if there's something they can do to help with those side effects, and then really have them weigh the benefits of taking that, because sometimes it is more important to take it to treat what's going on. Medications can also have similar side effects. So what do I mean by this? Side effects that can overlap. So if you take too many stimulating medications at night, that can really disrupt your sleep. If you take too many sedating medications during the day, that can cause someone to actually appear sleepy in groups. Now, this doesn't mean the person shouldn't take these medications. Every single one of these medications can be a legitimate medication that treats a disease or condition that they have. They might need every single one of those medications. However, if they're having trouble participating in a program, engaging in treatment, it could be related to the medication. So what I want you to do is I want you to tell your program director right away, and I want you to assist that resident contact their provider. Let them know they aren't getting as much out of the program as they could. It may be the medication. It could be a simple solution as they might need to space out or take those medications at different times, or maybe they just need to adjust the dose, or maybe they just need a couple days to use their body to get used to a new dose that they just started. Either way, just remember that sometimes the side effects overlap and to reach out to the prescriber if you think there's any type of issue with that. Now I want to talk to you guys about the characteristics of a medication. All right, medications have the following characteristics all in common. Name and strength. These are specific to actually the medicine. So for example, ibuprofen, that's the name of the medication, and it comes in a 200 milligram tablet. That's the strength. That's how much medication is in that tablet. Now the dosage form, route of administration, and frequency, those are actually specific to the resident. So take 2, that's your dose, tablets, your dosage form, by mouth, your route, how you're going to take it 3 times a day, that's a frequency. It's important to know that there's some things that are specific to the medicine, and then there's some parts of, which is pretty much your entire set of directions, that's going to be specific to your resident. Regardless, every prescription, over-the-counter drug, vitamin, or supplement has a recommended dose. And if we're talking about a vitamin or a supplement, it's going to have a suggested daily amount. It's going to have a suggested directions for use. It's going to be on the label or the container. Those have to be labeled that way by the FDA. They require those labeling requirements. So look on there. Sometimes if it is a supplement, because those are regulated as food, I will say that the dose will be written as a daily serving. So it might say chew 2 gummies, meaning 2 gummy multivitamins once a day. That's what you would put then on your medication tracking sheet or a medication administration record, however you document the medications at your program. Now, medications have a lot of names. I know this is sometimes overwhelming and another thing that confuses you guys. So yes, most medications, they do have a brand name and they do have a generic name. The brand name is typically chosen by the drug company that brought this drug to market. These are easy to remember. For example, Benadryl. Benadryl was brought to market under that name. The generic name of it is actually the chemical name of the medicine. So it's actually the active ingredient, which makes the medication work. These are typically harder to spell. They're much harder to pronounce. So for example, Benadryl is the brand name. The actual generic name, the ingredient that makes the medication work, is diphenhydramine. Now, many brand names contain the same generic medication. So Benadryl, Tylenol PM, Unisom, those all contain diphenhydramine. I don't want you guys to get overwhelmed with the names. I want you to just know that some medications have more than one name, and whatever that name is on the bottle or the package in front of you, that's what you're going to document on that medication tracking sheet. Don't get too nervous about it. It's right there. Just write exactly verbatim what it says off the package. Now, people ask, okay, so there's brand and generic. Really, like, what is the difference? Well, the brand and generic, it's the same active ingredient, it's the same strength, same dosage form, same route, same quality. They have to pass the same quality, safety, and standards by the FDA. Where they're different is they're going to have a different price. Typically, the generics are cheaper. They're cheaper because they were brought to market second. So they didn't have to necessarily invest in the cost of the research and what went into creating that drug in the first place, which means it's cheaper for them to produce it and cheaper again for them to sell it. Could have different packaging, could be a different shape and color, and could have different inactive ingredients. And what do I mean by inactive ingredients? I mean, these are things like the filler. So someone who has, let's say, allergies to red dye, possibly a gluten allergy, they're going to want to pay attention to the inactive ingredients, because even though it's going to be the same active ingredient in the medications, one medication could actually have red dye, it could have gluten in it. And if someone has an allergy to that, even though that's not what's causing the medication to work, we want to make sure, just like if there was red dye or gluten in a food, that they would know that's in there. Those are all going to be listed on the back of the package or of the bottle. Okay, back to a audience participation question. So I have 3 medication boxes here. What do the 3 packages have in common? A, they're the same medication. B, they're different medications in the same size packaging. C, they're different medications made by the same drug company. Or D, nothing. They're just all different. And we'll give you guys a couple minutes to answer. I see some things are coming in. Okay, yep, everyone who guessed A is correct. These are actually the same medication. So you see Suboxone in the corner. That is the brand name. Then you have the 2 generics, which are your buprenorphine, naloxone, sublingual films. These are all the same medication. They're all the same strength, the 8-2, they're all the same active ingredients. They're different drug manufacturers. 2 are generic and 1 is the brand name. All right, let's talk about medication strength and dose, because this is going to be important for documentation. Strength is actually the amount of active ingredient or active drug in the medicine. This is going to be typically written or expressed in milligrams for pills and milliliters or mLs for liquids. The dose, on the other hand, is actually the total amount of medicine that's going to be taken by a resident at a given time. So for example, take 400 milligrams, or that could be equivalent to like take 2 tablets, or take 5 mLs, or 1 teaspoonful. That's the dose of the medication. The strength, many people can take, for example, ibuprofen 200 milligrams. Many people can be prescribed, well, they would most likely be prescribed the 800, but let's just say that they were taking the over-the-counter 200 milligrams. One person might take 1 tablet, someone might take 2. So that's going to be where the dose, again, is different. So if you look at 400 milligrams, 2 tablets, 200 milligrams is 1 tablet. Another important thing to note is strength and dose don't have anything to do with the size of the pill. So just because it says it's 40 milligrams doesn't necessarily mean it's going to be double the size of a 20 milligram tablet. Small tablets can pack a large effect. They can pack a big punch. So don't take it, less serious just because it's a small tablet. Now, sometimes dose formulations are specialized. Some doses are specialized and release a medication over time in the body. There are some that are released immediately, so an immediate release. There's some that are extended release, so it'll say ER, XR, XL, or XT, or sustained release, which is SR. It's critical to write out the complete dose, including its formulation, so that ER, XR, XL at the end. This is going to be how you prevent your medication errors. Residents often can take 2 doses of the same medication. They might take an immediate release in the afternoon and an extended release in the morning. They might take an extended release just as their normal regular dose, and they might use an immediate release for any type of breakthrough symptoms. It's important to know that an extended release is typically taken once a day. An immediate release is typically taken 2 or more times a day. Here's a perfect example. So here is one medication, acetaminophen, also known as Tylenol, where the strength and the dose and the frequency is different, even though it is the same medication. So if you're looking at and these can come in very similar packages if purchased over the counter in the aisle in the pharmacy or even in a supermarket. So if you're looking at Tylenol, regular strength, it's 325 milligrams per tablet. These are the directions that are right off the back of the box. These are the FDA approved directions. So 2 tablets every 4 to 6 hours as needed for pain. If you then took Tylenol that was the extra strength, that's actually more per tablet. That's 500 milligrams per tablet. This is 2 tablets every 6 hours. And there's also an extended release. This is actually a 650 milligram extended release tablet. And that is used 1 tablet every 8 hours, no more than 3 in a day. So we can see how if we do not put that extended release or extra strength on the end, or even regular strength, if someone takes, let's say, the extended release, a 650 milligram tablet, and they take it every 4 hours, they're going to far exceed the FDA's recommendation for the maximum you can take in a single day. And this can be dangerous for residents. If you take too much acetaminophen, it can impact the liver. So this is why it's critical. We've got to properly document our strength, our dose, and that formulation on the med tracking sheet or the MAR. Here's a good example that you will probably see often in many of your facilities. So a resident may take 2 doses of Adderall for ADHD. So I have 2 on the side here. One is the immediate release, 20 milligram, and one is the extended release, and it's a 20 milligram capsule. How long do the effects last? Your immediate release is 4 to 6 hours. Your extended release is about 8 to 12. So what happens? This person's prescribed 2 Adderall, both are 20 milligrams. If we wrote this out on the medication tracking sheet as Adderall 20 milligram, take 1 pill once a day, and then Adderall 20 milligram, take 1 pill twice a day, there really is no way to know which directions match which tablet or which capsule. And because of this incomplete documentation, actually what ends up happening, the resident takes 2 extended release 20 milligram capsules. They're up all night, they're unable to sleep, and they don't participate in the program the next day. Now we're lucky here because this is a tablet and a capsule. Capsules usually are the extended release, and immediate release typically is the tablet, but that's not always the case. Sometimes these medications can look very similar. So if somebody did take 2 extended release, we can see how this could impact their participation in the program. Now, the correct way to actually document this would be Adderall, 20 milligram, extended release, XR, take 1 capsule by mouth once a day. Adderall, 20 milligrams, immediate release, IR, take 1 tablet by mouth twice a day. The other medication, so many of the ADHD medications, specifically your Adderalls, which are, amphetamine, dextroamphetamine, that's the generic names for them. Or the other one, the major one you might see is bupropion. So bupropion comes in an immediate release, a sustained release, and an extended release. Each one of those, the extended release typically taken once a day. An immediate release is going to be taken sometimes up to 3 times a day. A sustained release is going to be twice a day. So it's really important to actually write out the release on the end. If you see that, XL, XR, make sure to write it out. Now we're going to talk about the dosage form and the route. Route is how and where a medication will enter the body. And this is very much linked to the dosage form, because this is the physical form of the medication. I think it's easiest to illustrate this by a chart. So if someone takes something orally, this is the most common route, so by mouth. The dosage forms that can be taken by mouth are going to be your tablets, your capsules, liquids, gum, lozenge, even inhalers, right? Now, if you take something sublingually, so place it under the tongue, that's going to be something different. That's going to be a dissolving tablet or a dissolving film. Something that is topical, placed on the skin, that could be a patch, it could be a medicated cream, ointment, powder, gel, or even a spray. Nasal, so something that's used in the nose, that's going to be most likely a spray. Something that is given anally, that could be a suppository, it could be an enema, sometimes creams are also used. Anything that is a vaginal medication, it could be a suppository, could be a tablet, cream, ointment, or gel. And then there's injectable medications, and those can be solutions and suspensions. So I think a good example of these is insulin. Human insulin is a solution, okay? Now naltrexone, the extended release injection, so the Vivitrol. Vivitrol is actually a suspension. It comes as a powder, and that powder is actually mixed with a, how would I explain this easily? It is mixed with a diluent. So that is so we'll call it, it's almost like a solution, but it's mixed and it's actually suspended in that. So when a resident goes and gets their Vivitrol shot, what will happen is typically a nurse will take out the vial, which contains the powder. That's the active ingredient. And they're going to mix it on the spot. They're going to mix it with the solution, which is going to make it be able to be injected. And that powder is going to be actually suspended in that. So there's 2 key differences there. Medication frequency. All right. Frequency is how often a medication is taken. Medications can be taken on a scheduled basis. These are the ones that are taken regularly. So for example, once a day, twice a day, every 6 hours. And then there's our as needed medications, our PRNs. These are typically taken when a specific symptom occurs, such as pain or trouble sleeping, or could even be something that is taken before a specific event. So if you're traveling and you get motion sickness, it might say take 30 to 60 minutes before travel, or before getting on a plane, or before getting on a boat. Either way, a PRN, when taken, so something taken as needed, that doesn't mean take again and again until the symptom is gone. That's not actually what it means. It means to take when the symptom occurs. Medication taking is very serious business. We have to pay attention to the details here, whether the medication is taken regularly as needed. It does not mean that it can just be taken anytime for any reason for anything. We play an important role here, okay? One important thing to remember is a medication can have multiple strengths, doses, and dosage forms. And I think the best example of this is nicotine replacement therapy. So the nicotine products that are used for people to help them quit smoking. We know that nicotine can come in a patch, come in a gum, come in a lozenge, and we can get these all over the counter. There's also prescription nicotine nasal spray and nicotine inhalers. Now, this is the same medication, and there you go. It comes in multiple different dosage forms, and it has multiple different doses. And we know that those doses and those strengths are based on how many cigarettes that the person smokes in a day. So it's going to be different per person. But this is an example of how one medication can have these different strengths, doses, and dosage forms. And we're going to do another audience participation question. And this is something for you to also test your knowledge when you are at your program. So we're just going to go through and we're going to name each of the characteristics that we went through. So when you're looking at this prescription bottle, you open it up and you see these are these films inside. So what is the name of this medication? So the brand name here is Suboxone, which you see there on the film. And the generic name is underneath it in the parentheses. So that's the buprenorphine naloxone. The dosage form is a film. It says right on there, sublingual film, and it also says in the direction, films. The route, so how is the person putting this into their body? Sublingually, that means dissolve under the tongue. So there are the directions. Dissolve 1.5 films under the tongue twice a day. Sometimes it will say place under the tongue. Strength. 8-2. This is probably one of the more confusing medications and also one of the more common medications that you'll see. So 8-2, what does that mean? It means each film actually contains 8 milligrams of buprenorphine and 2 milligrams of naloxone. What's our dose? So our dose here is the individual is supposed to take 1.5 films. Frequency, they're supposed to do it twice a day. And then here is a curveball. What is the total daily dose? So the total daily dose is 3 films. They're taking 1.5, which is their dose, and they're taking it 2 times a day. So 1.5 times 2 is 3. So it's 3 films per day. Very critical for us to document what, how, and when something is taken for every single medicine. What, the exact medication name and strength. Copy that right off the bottle, right off the package, even if it's over-the-counter vitamin. How? What's the exact dose, the dosage form, and the route? Remember, if it's a specialized dose, put on that XR or that XL for extended release. And when? The exact frequency. How many times a day are they taking it? And also the exact time that they take it. All right, now to wrap up, these are our medication basics best practices. So what you should do read the label. Do read the label on every medication container and bottle that comes in. Immediately notify your supervisor if the label is unclear, if it's been removed, you just can't read it, the box has been torn, because we can't really guess on these instructions, right? We can't just assume that someone's supposed to take something a certain way. So we're going to have to reach out to the provider if it's prescribed. If it's an over-the-counter, we're going to have the resident go and purchase another over-the-counter bottle so we can see what what the actual instructions say. Do provide water for the resident to take the medications in the med room. Do document the medication name, strength, dose, date, and exact time a resident takes, whether it's a resident or a house supply of the medication. So what I mean by exact time is if, let's say you have 4 medication hours a day. You have them in the morning, and you have them at noon, and you have them at dinner time, and then before bed. If you just have a medication sheet already pre-filled out that says, let's say it's 7 a.m., 12 p.m., 5 p.m., and 8 p.m., that's not the exact time someone's taking something. So it's very hard to see what someone's adherence is, or if they are taking things maybe too far apart or too close together. It's going to be very difficult if the exact time isn't noted, and really that is the best practice. You're supposed to be noting the exact time that the person comes in to take that medication. We really can't be rounding to the nearest hour. Also, do encourage your residents to take medications as prescribed on that prescription bottle or as directed according to the directions on the back of that package or container for a vitamin or a dietary supplement. And do ask another staff member if you have a question or concern. Don't ever guess. This is serious business. In conclusion, medications work in a variety of ways, and they have the potential to cause desired or undesired effects. Remember, all prescriptions, over-the-counter drugs, vitamins, and supplements are considered medications, and these should be handled with the same precautions. Medications come in a variety of different shapes and sizes, so documenting the complete name, strength, dose, and direction is going to be critical to preventing any med errors. And congregate care workers and clinicians really do play a very important role in supporting residents take their medications correctly and safely. And we're truly hoping that this webinar series will help not only teach you guys more about medications, but allow you to feel more comfortable and give you more tools so you feel confident doing your job with monitoring these medications in a congregate care setting. I'd like to, invite you guys to join us. We are going to do a follow-up congregate care call on Thursday, January 14th at 9 to 10 a.m. And that call is going to be focused on medication basics. So this webinar, any questions you have about this webinar, or any questions that you might have that are specific to maybe your facility or your program that have to do with any of the information that we brought up in this webinar. We do ask that you email us these questions before. We will have the chat box open, so you will be able to type them during the congregate care call, but it is very difficult when there's many people joining if people are talking over each other. So we will answer every single question that is emailed, and if you can't email, we will have the chat box open during that live call. And I want to thank you all for listening. I hope you guys have a great rest of your week. Thank you.